So maize can be called flatus, or you can call it flatulence, or wind, or mess. So everybody mess, we know that. Everybody mess. Mess can be normal because it can be a byproduct of digestion. Okay, it can be normal, but we have some situation where mess become embarrassing. Do you know that? When it become too loud, it sounds like a thunder. Or when it smell like a rotten egg. Smell like a rotten egg. Or a situation whereby it causes some bloating of your stomach. It causes your stomach to get bigger, or it causes some rumbling sensation in your abdomen. Or sometimes it's accompanied with some pain. Madam, it's no more a normal mess. And on occasion, you mess too often. Every minute. You want us to run away? No, we will stay in this earth together, not be only you. So these are situations where your mess become a problem, okay? So what really causes mess? Because we know we have a number of things that causes it. Let's talk about it. So mess can be caused by normal digestive process. Some people, whenever they're eating, they are swallowing air because they are talking too much. You can't close your mouth shut. You are eating and talking. See how you're supposed to eat. Close your mouth while you eat. Okay? So when you talk and eat, you have high tendency of swallowing air. Of course, if you swallow air, it must get out. Either it get out through your bum bum, it get out through your mouth, or it get absorbed into your bloodstream, or it gets to your lungs. So it must get out of your system. So sometimes it come out as flatus, okay, or mess. Some people mess because of the food they eat. If you eat some food that are so difficult to digest, mostly legumes, something like beans, or some dairy product like milk, or even some fiber containing food, it produces a lot of flatus. It produces a lot of gas during their digestion, and that gas must escape, and it must escape either through your mouth, come down through your anus, and we call it mess. So then some people have a lot of bacteria, host of bacteria in their GIT. All of us have it. Bacteria that help us to digest food. So these bacteria, when they digest the food, when they ferment the food, they produce some gas, which is mess. It come out as mess. Some people have some conditions like what we call irritable bowel syndrome, or their bowel don't really function well. So when in such condition you can produce too much flatus or mess. Then these are just the condition that can produce mess. Okay, so if you eat some certain food, of course you will produce a lot of mess, like garlic, onions, beans, some dairy food like milk, egg. You produce a lot of mess just because some of them they take a lot of time to digest. Some of them require some number of bacteria to act on them, and this bacteria will produce gas. All right. Sometimes your mess is normal. If you don't produce mess after surgery, madam, you won't eat. You will until you produce mess. Mess show that your bowels have returned back to their normal state. If you don't produce mess after CS, no. So sometimes your mess can be a sign of some disease conditions. Okay, if you mess a lot, if you mess all the time, and then you feel inability to poo, and you have abdominal pain, you might be constipated. So you have to soften your poo, maybe by eating fiber-containing food, roughages, drinking a lot of water, and then by exercising a little bit. Okay, then sometimes you might feel bloated after eating, and you mess a lot, then plus pain at your lower abdomen. You might be having what we call irritable bowel syndrome. Don't ask me about that, okay? Don't ask me for the meaning. Then occasions you might have indigestion. You just finished eating, but you feel like this food has not digested. Then you'll be messing a lot, plus diarrhea, loose bowel motion, and sometimes a little bit of pain at your abdomen. You may be having celiac disease. Don't ask me to explain, please. Sometimes you might be messing a lot, plus diarrhea or loose motion, and sometimes you might feel like you want to vomit, and a little bit of pain. You may be having what we call lactose intolerance. Okay, Then meds can be a side effect of some medication you are taking. If you take too many painkillers like ibuprofen, diclofenac, you might produce a lot of mess. Do you hear me? If you take some medication like laxative to soften your poo, you might produce a lot of mess. Then if you take some medication for cholesterol, all these statins, you might produce a lot of mess. So mess can as well be a side effect of some medications. So I hope you understand. Not all mess are normal. Okay, so let's talk about do's and don'ts when you come to mess. If you're messing a lot, there are things you need to do, okay? And there are things you must avoid. Yeah. If you mess a lot, you have to try to eat food in a small quantity. You can eat quite often, but try to eat small quantity, okay? You mustn't finish the whole food in the pot once, okay? Then try to chew food or drink, liquid slowly. Okay, when you want to chew food, try to close your mouth while chewing. Do you hear me well? Stop talking too much while eating. The other thing you have to do is that try to drink peppermint tea. They help to, remove the air. Do you hear me well? Then exercise a little bit, okay? Because exercise increases the bowel peristalsis. What did I say? Bowel peristalsis means the way your food is being digested, the way your food is being moved in your GIT. So when you exercise, it improves bowel movements. So these are just the do's, things you have to do if you want to reduce. So on the flip side, there are things you must avoid. If you produce a lot of mess or flatus, you should always reduce chewing gums. If you chew gums a lot, reduce it, okay? Because whenever you are chewing gum, you are swallowing air, okay? Then if you use dentures, if you have fake teeth, okay, make sure they are well fitted. Okay, it's very important. Then try to eat food that are easy to digest. Some certain food will take a lot of time to digest. Try to minimize consuming them. Something like beans, some fibers can as well cause problem with your digestion. Then some dairy products, if your body don't digest them well, minimize them, because during the process of digestion they can cause a lot of flatus. Then try to reduce alcohol intake. Alcohol can cause you to mess. So reduce the amount of alcohol you consume, please. So these are just things you have to avoid if you want to reduce the amount of you produce. Bye bye.